Hi, my name is Melissa Davidson. I'm an attorney with Hankey Marks Crider, and I wanted to talk with you today about VA service-connected disability benefits for diabetes. Now, diabetes can be a presumed disability, which means if you've been exposed to Agent Orange and later developed diabetes, that is presumed to be connected, and there's not a lot of proof or a medical statement required stating that the diabetes is related to that because the VA has acknowledged that Agent Orange can cause diabetes. The other way to have a service-connected diabetes condition is if it develops while you're in service or within a year of getting out of service, a year of discharge. So if any of those things have happened with you and you have diabetes, pay attention because I want to talk to you about the percentage ratings and what's required for each one. So just having the diagnosis of diabetes on its own will be rated at 10%. That's the kind where you can just manage it by diet. If things are worse and you require a daily dose of insulin, as well as maybe oral medicine to help manage your condition, that will increase the rating to 20%. The VA ratings then jump to 40%, and this is in the for situations where a person requires a daily injection, restricted diet, and may also need to regulate your activities. If you have blood sugar fluctuations that are affected by activity or work, then 40% rating is warranted for that. The VA ratings then jump to 60%, and this requires insulin, but also hospitalizations or twice-a-month visits to your diabetic care doctor. And so this is kind of important to know because if you do have trouble controlling your diabetes, it might be important to talk to your doctor and get on a visit schedule that will help facilitate you getting a more accurate rating with VA. And then beyond 60%, it jumps all the way up to 100%. And these are for folks who have at least 3 hospitalizations a year or weekly visits to the diabetic care doctor. And this would have to be a diabetic situation where you're really unable to work. It interferes with your function with recreational or exertional activities. So if you have trouble getting exercise because of blood sugar fluctuations, or as I indicated, difficulty being in the workforce, then 100% rating will certainly be warranted for that. So if you would like assistance in getting or increasing a diabetic service-connected rating, reach out to the attorneys here at Hankey Marks Crider, and we'll be able to help you put together the best case possible.